See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
This is See You Now, and I'm Shauna Butler.
Necessity has been the motherhood of innovation these past many months. These programs and these technologies that were not previously used for contact tracing were programs that were not on our radar from a public health perspective up until now. It's going to change the way that we as a city engage. The fact that contact tracing specifically has been such a multi-agency approach from health and hospitals, from the health department, from the technology agency. Hopefully when we come out of this, these relationships will be tighter and allow us to function as a city even better than we are in this crisis world that we're currently living in.
'20 2020 has reacquainted us with the time-honored language and lexicon of public health. In addition to becoming trending hashtags, flatten the curve, testing and contact tracing, and social distancing have become not only the life-saving practices in our daily routines, but also the main topics of government briefings and the primary tools of our public health emergency response to COVID-19. In this episode, we meet nurse and deputy director of the New York City Test and Trace Corps, Kathleen Blaney, and go deep into the details, the complex choreography, and the innovations of contact tracing, and learn the intricate dance steps of breaking the transmission chain of a communicable infection and reining an outbreak in. In our wide-ranging conversation, Kathleen describes what it takes to create a new workforce, a culture, and a shared sense of purpose remotely. We talk about how the highly personal nature of contact tracing can strengthen science literacy and vaccine confidence and help build trust in public institutions and trust in each other. I started by asking Kathleen to share a bit about her background, what prepared her to meet this historic public health moment, and to let us in on what innovating in a public health setting means to her.
When I was an undergrad, I was interested in both nursing and political science, and that's what drew me to public health, is the alignment of those two schools of thought. My name is Kathleen Blaney. I'm a registered nurse. I am the Director of Disease Control Emergency Preparedness at the New York City Department of Health and Mental Hygiene, and I am the Deputy Director of Contact Tracing for the New York City Test and Trace Corps, a group that has set up contact tracing for all 5 boroughs of New York City. I worked at a FQHC in Wisconsin, where I'm from, an HIV clinic for several years before moving to New York. It's been really interesting approaching the whole COVID response and contact tracing as a nurse. The lessons we've learned in COVID and in any public health department are applicable regardless the size of the city. I think there have been some unique challenges that have come as part of working in a city as densely populated and as unique as New York is, but the challenges are not always unique compared to the challenges that we face in Wisconsin or in other areas when it comes to emergency preparedness and contact tracing. To me, innovation in public health is unique because it requires fundamental understanding of the health action or attribute that you're trying to impact, as well as having a nuanced sense of how that is impacted by socio and economic factors, environmental factors, mental health factors. So it's not just looking at an issue from strictly physical health lens. It's being able to approach it from all of those different perspectives, because the way someone is able to achieve a public health goal is by taking those all into consideration.
So the New York Public Health Department, it has quite a historic reputation in a very good way for many reasons. What do you know about the New York Health Department that you wish everybody else knew? What are the hidden treasures and gems?
My personal bias is that the people are the hidden treasures and gems. I think
Mm-hmm.
to provide services to a city as large and diverse in New York, the makeup of the health department has to reflect that of the city. One thing that has been so incredibly impressive to me is every day I learn more and more about the services that the health department provides. So I'm in the communicable disease world of the health department. That's only one part, but in that one part, you have vaccine preventable diseases, you have sexually transmitted infections, tuberculosis. And so in and of itself, that specific division covers all infectious diseases in the city of New York. But separate from that, we have teams that work on mental health, mental hygiene. There is a whole division dedicated to primary care, chronic care, access to care. When you think about the role of the health department, it really is hard to pinpoint because it's so comprehensive and so integrated into various facets of life of New Yorkers.
Just your title alone, Director of Disease Control Emergency Preparedness at New York City Department of Health and Mental Hygiene. That's an awful lot. And as you mentioned, that's just one division. The size and the scope and the history, what can you say about that?
I think the Division of Disease Control at the Health Department is one of the largest divisions. There's around 1,500 individuals who are employed in public health, epidemiologists, as well as outreach teams and analysts. And we also have clinics for a lot of the clinical services. So I do think disease control is one of the larger divisions. I will tell you, Shauna, I started in this role in April, which was an interesting time to come into an emergency preparedness role. So
talk about drinking from a fire hydrant.
Yeah. When I started at the health department, I was working in the Bureau of Immunization. And so I worked a lot on the citywide immunization registry, really got involved in emergency responses during the measles outbreak last year. And during the time of the measles outbreak, I started working as one of the deputy branch directors for our healthcare system support team. That's part of the health department's incident command system. And so I really learned more about the incident command system during that time. I began working in COVID, mid-January, before we were even fully activated. I will tell you, I think that has been and will be one of the most humbling experiences of my life, working in healthcare system support January, February, March, April of this past year, because I think learning about this virus in real time and working with our healthcare partners to understand it and sharing information as we got it in real time, but then also trying to work with the healthcare system to make sure that they had enough staff to accommodate the surge, that they had enough space to accommodate the number of patients who were coming in, and they had enough stuff, including ventilators and masks, whatever equipment that healthcare providers need. And so those are the three kind of issues we focus on: our space, staff, and stuff when it comes to healthcare system readiness.
Space, staff, and stuff.
Mm-hmm. And so I think it kind of felt like baptism by fire. I think going from working on that healthcare system support team during COVID was kind of how I fell into this role as Director of Emergency Preparedness for the Division of Disease Control, and has really, I think, informed the work in my perspective in terms of how we engage with providers when we start contact tracing.
I certainly hope you are keeping a diary. Just go back to February, March, before you step into this role. You're on a team that's managing what presumably measles outbreaks and some of the other infectious diseases. I mean, contact tracing and communicable disease control, that's a lot of work going on just to begin with. So we're going to cast Kathleen Blaney in the starring role of this action drama thriller science, and it's not science fiction, it's science nonfiction. It's this big science reality story. How does it unfold? What phone calls are you getting and what requests? I mean,
Sure. And I can't overstate. To get back to my previous statement about the hidden gems of the health department being the people, I think I'm going to have a hard time saying this without getting choked up, but I have never worked with so many people who care so deeply and share all of their time and talents as I've seen during this outbreak. And I think that's true, obviously, not only of, sorry, I didn't mean to get quite so emotional.
You know, a wise young woman once said to me, the best way to make friends is to do really hard things together.
Yeah.
Yeah.
I think that's it. And I think so many of the people that I worked with at the health department are people that I had not been interacting with much outside of, maybe the measles outbreak. And so I think learning about people and working with people when they are being pressed to the top of what they're capable of has really been an impressive feat. And I have so much respect for everyone I have worked with during this endeavor. I guess that's more of a sidebar, but looking back, January and February really feels like a lifetime ago in so many ways. Everyone has been so impacted by this pandemic. Thinking back to those earlier days, I was reflecting about being in a meeting where we were on the CDC webpage, clicking refresh because we knew the updated guidance was coming. At that point, we were so thirsty for any new information we could find about this virus and really knew that it was incumbent on us to share that with our healthcare partners and the people of New York so that they had the most up-to-date information in terms of how do we test, who gets tested. Part of our responsibility of the health department was to be able to deliver that information in a timely and digestible way, not only for the healthcare providers, but also to all of the citizens of New York. I think being faced with the reality of that and thinking now to where we are versus where we were back then is humbling and also so important to informing the decisions we make.
You mentioned the work, and this work that you have taken upon you and truthfully just stood something up that did not exist. It is incredible. I mean, it is mind-boggling. The rapid pace, the scale, all of the partnerships, the working across all these different disciplines. All right, Kathleen, a couple of months ago, the TTT, the Testing, Tracing, Take Care team did not exist.
Mm-hmm.
The people within your department look to you. Okay, Kathleen, what needs to be done? Walk us through what you did. And I'm thinking about from the standpoint of, at this point in time, we have some great tools, some technology there. How did you build this, and what was involved in doing so?
Of course, and first of all, I cannot take nearly as much credit as you're giving me, Shauna, because really this has been such a collaborative effort. It has taken collaboration with the city's IT agency to make sure that all of this work is done effectively and securely. It has required close collaboration amongst multiple partners. So I will just couch it with that. I think, the collaboration has been key, and working across multiple systems has been challenging because we need to bring the appropriate people and technologies together in a way that makes sense and adequately and appropriately services the people that we're trying to reach. And so the technological aspects that involve rapidly getting test results into our contact tracing system, and rapidly and securely, I should say. We use Salesforce, which is a platform that the health department does not normally use for contact tracing, but given the scale of contact tracing for New York City, we had to land on another program. And so I think we ourselves becoming proficient in it and then training everyone who's using the system to become proficient in it has been something we had to do very quickly.
It's really important to note that this is not a core offering that Salesforce has in place, nor is the health department used to working with that tool.
Sure. So no, you're right. And this is, again, working with a new database is not a challenge that's unique to New York. We've talked to partners in other jurisdictions and had to come up with a way to capture case data and contact data again, I keep saying at a scale we've never seen, but it's so true. Everything about COVID is at a scale that we have not seen. And so that has been a learning opportunity for all of us, from the implementation team, like the Test and Trace Corps staff, as well as making sure that our contact tracers know how to engage with it. So that has been an undertaking. I think being remote has been a unique challenge. Trying to train a workforce of 3,000 people without the benefit of being in the same room is something that our team had not previously had to consider. There's also really the importance of building community and building connection amongst the different teams that is challenging when everyone's remote. So I think everything about COVID and contact tracing COVID has been further complicated by the fact that we are all in our own spaces, and how can we make these own spaces feel more like a team.
Well, you didn't have that workforce ready to go. I mean, you had
No.
to so let's talk about how you developed this workforce. I mean, where did you find them? And on top of that, it's not like you knew a whole lot about COVID at the point in time when you were hiring. So how did you go from nothing to having 3,000 people with this new problem of onboarding them on remotely?
I would say there were a lot of people who didn't sleep for the month of May, Shauna. um, so and again, just to underscore, especially at that point, we were at such a unique time where we were able to capitalize on the low case count. We had to act quickly. The ramp up was fast and furious. So I think we really had about 3 weeks between the first week of May and our launch on June 1st to onboard the appropriate staff. We have a pool of case investigators, and we have a contract also separately with Optum, who has helped us with a large part of the onboarding and training of our contact tracers. But you're right that it took a lot of blood, sweat, and tears to get everyone onboarded and with the equipment they needed and the training they needed. I cannot give enough credit to our training team, who really had to explain what is a case investigation and here's how you do it and here's how you do it well. And here's the technology you're going to need to do it. And so, it's how are we going to train from the get-go, and then how do we deliver that repeated training is something that we are continuously considering and is of such importance because, again, it gets back to the point you raised earlier about developing trust and developing trust in the public health infrastructure long after COVID is over.
There's a real language about that from the standpoint of, here's the information that we have today. We are continually learning. We will be updating this. And that's very hard for a lot of people who want to know. They have this sense of, I want to have very clear guidance. I want to know, what are the indications for being tested? What are the indications for what's considered an exposure? And in addition to sharing that with the public, you've got this workforce now that is having one-on-one conversations and wants to feel confident that they are giving accurate information, and also do it in a way that says, this is subject to change in light of new evidence. The wheels are spinning as I am thinking about the complexities of just managing the workforce and the tool and updating the databases, the clinical decision trees that need to be installed. I'm feeling your pain. Is that?
I'm like nodding emphatically.
You're laughing knowingly.
No, I am, because I think when we're talking about how to deliver information, I think what you said was right on about, having these individual conversations. This data is from like a week ago, but until December, we've had over 101,000 individual conversations. And that's just for cases. For contacts, we've had over 124,000 conversations. And so trying to make sure that the contact tracers have, at that moment of that call, the most accurate information that we can provide them is something that requires continual assessment and implementation and prioritization, quite frankly, because what we find to be important one week might still be important the next week, but oh, by the way, here's this new update to what's happening with COVID and how it's impacting New Yorkers. So it is a lot of assessment and reassessment, and then also making sure that the 3,000 people we have on staff are equipped to be able to do that work effectively.
What is the bedtime story that you would share with grade school children when they say, Aunt Kathleen, what is contact tracing?
Contact tracing, in its essence, is the ability to identify that someone is sick and identify the people around that person, their friends, their family members, their coworkers, their classmates, to see, were they exposed and are they at risk of also getting sick? And then what we need to do as contact tracers, educate people on the virus and let them know what services are available to them, and advise them to stay safely separated from other people during that time where they are either infectious or potentially could become infectious. Contact tracing is a robust and often used tool in public health. I think people are most familiar with it in the context of Ebola or smallpox. But performing contact tracing on this scale, where it's not just New York City, which in and of itself is 8.6 million people, and not just the United States, but globally, to perform contact tracing on a global level, it's not something that's ever been done, and really it requires tremendous partnership. It's a time for all of us, whether we're public health professionals or clinicians or people who have been staying at home, all to do something impactful at a time when the world has never been more dependent on public health.
So contact tracing doesn't, sadly, magically unfold. There are a lot of pieces that go into this. So in its most basic form, let's talk about a success story that
Sure.
you were heavily involved with, the measles outbreak.
Yes, so the measles outbreak specifically in Brooklyn ended in September 2019. And at that point, there were 649 cases that were identified between September 18 and August 19. And we declared that the outbreak was over on September 3rd because we could say that there was no more community spread. To put that to scale, in New York City so far, there have been over 307,000 cases of COVID. In the United States, there's been over 14.8 million. Globally, there's been over 67 million. So I think the measles outbreak is certainly an interesting point of reference, but obviously the biggest differentiation there is the scale. Mm-hmm. But I think why contact tracing could be successful in the measles outbreak was that we were able, with each case, to rapidly identify when someone was a case, work with that individual or the clinic at which they were tested to identify their contacts or people who may have been exposed, and then reach out to those contacts to advise them of their exposure and offer post-exposure prophylaxis. And being able to offer that post-exposure prophylaxis in the form of MMR vaccine is a huge part of contact tracing and ending an outbreak, because in addition to notifying people of their exposures, you're also able to offer them a tool or a vaccine that will prevent them from developing illness if they have been exposed. One thing that has made COVID contact tracing challenging is that we're not yet at a point where we can offer people a way out. Yeah.
We are talking about the operational side of contact tracing. This, however, is incredibly personal. It can be emotional. There are lots of the human parts of contact tracing that come into play, and particularly with the history of contact tracing, the types of communicable diseases, AIDS, tuberculosis, these are the types of diseases that tend to have a stigma associated with them, where when you call and you start to have this conversation, it's not just a notification.
Absolutely.
There's a lot of therapy, sometimes commiseration, sometimes condolence. So let's walk through from the standpoint of, how does it actually unfold? How does contact tracing get initiated?
No, that's such a great question, and a way I think to kind of frame how these conversations get initiated. So I'm currently with the New York City Test and Trace Corps, which is really a 3-tiered approach to stopping transmission of COVID. So the testing aspect is perhaps the most self-explanatory, in that people are getting tested for COVID at their providers' offices. They're getting tested at pop-up sites. They're at tents. They're in mobile vans. There are ice cream trucks right now that are circulating in New York City doing testing. And all of the results for a positive test gets communicated to the health department electronically. And then that information on all the positive cases is sent to the Test and Trace Corps. And so what happens is the contact tracing is initiated once an individual has a positive test result, and we perform a case investigation. So there are over 3,000 contact tracers currently for the city of New York.
And those are just recently hired, right?
Yes, these are all people that we have onboarded since June. So when I speak to June 1st being an achievement in terms of the city being at a point where there was a low enough case count to effectively perform contact tracing, it was also a feat to get us to the place where we could meaningfully and accurately train our contact tracers to be able to have these types of conversations that I'll tell you about. Because you're right, it's not just a matter of collecting information. It's really about developing a relationship with the case and recognizing that you're speaking to them at a time that they're exceptionally vulnerable and scared, and especially if they've been living with other people or going to work, there's that concern that others have been exposed. So just to back us up, the case investigation is triggered once a positive result is received by the health department and sent to the Test and Trace Corps. And our case investigators will call someone who's recently been diagnosed, and sometimes they are the first people to share that diagnosis. So the tracers really need to be prepared to communicate this to the new case. We also provide them with education about COVID. So making sure that people have a space to have their questions answered and a reference point if new questions arise as a result of their diagnosis. We collect information about some of their symptoms. We advise them to seek medical care depending on what the symptoms are. And then we offer them wraparound services and hoteling, which is where that third pillar, the take care pillar, really comes into play. And that's something that I think is so special about our program, is that there are teams that are dedicated to allowing cases to isolate at home by connecting them to community-based organizations that will help support them by getting food delivered or finding someone to help them walk their dog or medication delivery, making sure that there are avenues for all of these resources to reach a case so that they can stay home while they're infectious. The Take Care team also has a hoteling option so that anyone who's been diagnosed with COVID can stay in a hotel free of charge throughout their isolation period, which, is important for anyone who's diagnosed with COVID, but I think especially true in a city like New York, where it's not uncommon for people to have multiple roommates or to be in a really confined space, given the dense population. And so really the goal of contact tracing is to disrupt chains of transmission. And if we can do that by helping support someone to stay at home and not having to go out to the grocery store, et cetera, to expose others, or give them a place to stay so they're not exposing themselves to others, that is another way that we can disrupt chains of transmission. We also then follow those cases throughout the duration of their infectious period. So if someone has reported no symptoms or minimal symptoms early on, we can, if they later develop symptoms, provide that appropriate medical referral. And just because someone says that they don't need assistance with food or rent or utilities on day 1 doesn't mean that they won't need that assistance on days 8 or 9. So that's part of the monitoring that we perform. Separate from the case investigations and monitoring, we then reach out to contacts. So one of the most important parts of the case investigation is eliciting contacts, people who this case may have inadvertently exposed while they were infectious. Could be someone they live with, someone they go to work with, and then also identify facilities that someone has been at while they were infectious so that a separate team can work with the facilities to identify people who may have also been exposed. So as a result of that initial case investigation, we take all of the contacts that have been exposed to that individual and reach out to them as well. And we perform a lot of the same assessment and services to those contacts as we do the cases. So we give them a call. We let them know they've been exposed. We provide education on COVID. We let them know that they too are eligible for wraparound services. And for both cases and contacts, we let them know the date in which it's okay for them to stop safely separating and return to normal activity. Similar to how we monitor cases throughout their infectious period.
So what I heard you say is the goal of contact tracing is to stop the transmission. Mm-hmm. But as you're telling me the story, it feels like there are many other goals. I'm wondering the types of conversations that you're having, the mental health issues, the loss of jobs, how many people that you've reached out to, and the major need that they might have is bereavement and grief counseling, because you might reach somebody and you ask them what's going on and they've lost somebody. This is not a checklist, it feels like to me. So can you speak to some of those, the human aspect of what goes on in the take care side of your core work?
So no, I think you're exactly right, Jana, is that, we have the objectives of what it is that we hope to accomplish in our conversations with cases and contacts. But you're right that these less tangible needs are ones that really require a lot of continued support and training for our contact tracers. So we have trainings that are specific to diversity and sensitivities around immigration, why someone might be more or less interested in accessing services or getting tested. We also do a module on trauma-informed care. These last 10 months have been incredibly traumatic for so many people, and there's not one person among us who hasn't had their lives impacted by COVID in some way, shape, or form. And being able to connect with an individual, not knowing about the specifics that led them to this point, but knowing that they have likely been impacted in some way, shape, or form is incredibly important. And our tracers need to be in a place where they can provide the space and time and empathy that making that human connection requires. Because really, one of the core tenets of contact tracing is developing trust and letting cases know that the information that they provide is kept confidential, and that also the names of the contacts they provide are going to be treated with the care and delicacy that the situation requires. And I think, in some ways, that is what brings me back to nursing and why it's so important to connect the two worlds, because they really are quite similar. Our contact tracers have a wide variety of backgrounds. Some of them have clinical positions in the past. Some, this is their first kind of foray into public health. It's not a uniquely nursing skill to be able to develop a relationship, but one that I think that nurses excel at.
Your contact tracing core, this workforce, they also have a really interesting opportunity on a proactive basis. And that is building trust in our institutions, trust in the people who work there, trust in science, and building, at this moment in time, a lot of vaccine confidence. As I'm hearing you, I'm thinking this is a really great opportunity for people to have had really good experience. So the next time when there's this outreach to say, we have a vaccine for COVID, it's in your area. By doing this well, you have a group of people who have trust, who have confidence, and you actually have a relationship with them now. How is that working and unfolding?
So I think you raised a really interesting point. Public health is a lot of the times in the background, right? Like, people don't think about us until there's an emergency. Right. And so I do think it's been really interesting to me, having been in public health for a number of years now, having friends and colleagues reach out and be really interested in what's happening, like on an epidemiologic level. And so I think it's really our responsibility, whether it be in the contact tracing space or in these other aspects of emergency response, that we do the job to the best of our ability and honestly and transparently, so that the trust that we do develop during this time where people are acutely aware of our actions carries over to, unfortunately, what will likely be other outbreaks. You're right that because we're kind of on this stage now where,
oh my goodness, Twitter has made famous.
Who would have thought that this would be the year of epidemiologists on Twitter? But it certainly has become that, because, again, it gets back to that thirst for knowledge and wanting to know when we're going to be able to return to life as normal, quote unquote. And so I think that is going to have long-term impacts on the communities we serve.
Yeah, people are hungry to resume human interaction, live music, dance, theater, particularly where you are in New York City, just a magnet and an icon for the performing arts. And our expression of humanity played out so beautifully across a range of stages with so many different talents. I can only imagine how crippling that feels, to have such a vibrant portion of the identity and the heart of the city being hit so hard.
One day I was heading back to my apartment, and I was walking from the Javits Center in April, which had been set up as a field hospital, and walked through Times Square. And Times Square was completely devoid of people. It was one of the most eerie and unsettling feelings. I've lived in New York now for 5 years, which is not long enough, I think, to be considered an official New Yorker, and often joke that I still hang out in Times Square too often to be cool, or too often to be a real New Yorker. And then seeing that space be completely devoid of the arts and tourism and people coming to learn what the city is about was a real challenge, and really poignant, and I think spoke to the importance of the work that we're doing, but also spoke to the incredible measures that people were taking during that time to make sure that we could bounce back. I mean, can you imagine an empty Times Square?
Having been there many times,
the
thought of an empty Times Square, I can't.
And I think, that made me a little bit, not even a little bit, it made me very teary to think that, inside this city of 8.6 million people, this threat is pervasive, and one that is going to be indiscriminating and who it impacts. But knowing that many people were able and willing for each other to stay home was very moving. And I think something that I want to give credit to New Yorkers too, not just New Yorkers, but people across the country who took and are continuing to take this as seriously as we can, is ultimately what makes not only contact tracing, but all the public health efforts successful.
So, Kathleen, you mentioned baptism by fire, and sometimes that is the best way to learn. I'm thinking about Mike Ryan with the World Health Organization and some of the comments that he's made, which is be fast, have no regrets. The virus will always move quickly, and if you don't stay on top of it, the virus will win. So we have this Biden-Harris coronavirus task force, and they got a big task ahead of them, and they got to build a force to do it. Based on your experience, what are the things that you would recommend in order to be successful and yet stay nimble?
Sure. And I'm so glad you said nimble, because I feel like that is one thing that is challenging in a population this size. The most important, I think, takeaway from the last many months is that listen to the scientists. Talking about nimbleness from a program level, I think one wonderful part of our program that I did not mention yet is that we have a team of community engagement specialists. So we have a core group of about 500 people at this point whose job it is to actually work in the community. So separate from the contact tracers who are performing calls, we have a group of people who can be deployed to different areas as needed. So one of the important elements of their work is if we have not adequate information for a case or a contact to reach them by phone, but we have an address, this team will go out to someone's home and provide them with the same information that they would during their case investigation, and then link them so they can start receiving their monitoring calls. This group also has been actively working with some rapid testing sites so that when someone gets a test result, instead of waiting for that lab result to make it to the health department and then to our system, which we know sometimes can have a few day turnaround time, they're with them on site to provide the initial assessment and elicit their contacts in real time. The team has also been working with the schools to help rapidly identify cases amongst students and staff and visitors so that when there is an exposure at a school, people have quick access to that information and in a way that they can act upon. So I think having this group that has been cross-trained to do case investigations and work with the contacts and do monitoring and can be deployed to various parts of the city allows us to have a little bit more flexibility, and being able to see the different ways that they've been able to provide services has been important.
You have been in the bowels of innovation at this moment in time. What are the things that are surfacing to you as far as just the mindset, the relationships, the operations? Like, how does innovation feel to you in the midst of this innovation melee? What are you learning, and what are your thoughts about innovation in general?
Really, this cannot be overstated enough that necessity has been the motherhood of innovation these past many months. These programs and these technologies that were not previously used for contact tracing were programs that were not on our radar from a public health perspective up until now. It's going to change the way that we as a city engage. The fact that contact tracing specifically has been such a multi-agency approach from health and hospitals, from the health department, from the technology agency. Hopefully when we come out of this, these relationships will be tighter and allow us to function as a city even better than we are in this kind of crisis world that we're currently living in.
You're collecting the data, the quantitative but also the qualitative, that is helping us to really appreciate and understand the disparities, the inequities, and hopefully the path forward to health equity. And so I would just love for you to comment on this experience and what it's surfaced and revealed for you in terms of the racial inequities and the other inequities that you're seeing.
One thing that was really important to us as a program as we stood up rapidly was to hire people who reflected the diverse neighborhoods across New York, and to hire people from communities that were disproportionately impacted, because we know so much being able to make a meaningful connection is a shared background or the ability to develop trust, knowing that someone has had a similar experience to you in life. So I think that has been an important part of our program, and one that has allowed us to be more successful than if we had not. You're right that the data that we're collecting is important and informs how we provide outreach to specific neighborhoods in terms of knowing where to place new testing sites and what neighborhoods could benefit from greater mask distribution, or how can we make our presence in specific neighborhoods one that is comforting and identifies the resources to which we're able to link people, rather than one that maybe is not as known or seems like a government entity and can be scary for folks.
Yeah, well, I would imagine just the small niceties. If you've got a group of people that reflect your community, and you're the Puerto Rican community, and there's a certain type of food, or there's a bodega that you get those things from. So if somebody's arranging and organize, here's a hotel for you to isolate in, and we're going to arrange food. And let me make sure that it's got the right spices. That says love. That's the language of love.
It is, and I also think that the Take Care program works closely with community-based organizations in the individual neighborhoods to be able to provide access to exactly those types of resources, because you're right that if the food that we're able to provide is not food that is sensitive to specific cultural needs or religious needs, it's in essence not providing any additional support. And so it's been a matter of plugging into what those specific needs are, and that's why it's important to gauge at the neighborhood level and not the borough or even city level. So,
and I would imagine that helps sustain those local economies.
Exactly. We're working with individual groups and neighborhoods to make sure that they're still able to keep running.
Yeah, once again reinforcing it's not an either or, public health or the economy. It's both.
Exactly.
And they intertwine. So we're recording this heading into the end of the year, and we have cases that are going through the roof. When we talk about that exponential growth, this summer, as we watched protests unfold and large gatherings, and we're increasingly seeing people gathering in tight spaces, I just wanted you to be able to comment on what is going through your mind when you see that, because I get concerned that people are being somewhat cavalier, or they're just not mindful. They see maybe nurses and doctors and respiratory therapists and people at the hospital, but you're behind a phone. You've got all these folks, and it just must be incredibly overwhelming. And so I'm putting a lot of words in your mouth.
Yeah. No, I everything you said is spot on, and it's true of like my colleagues at the health department. It's true of everyone doing contact tracing. It's true of all healthcare workers. I think the strongest message any of us can say is please, please, please stay home. New York was horrifically affected this spring. I know other parts of the country were as well, but looking at what we endured during that time and the way that we were able to get out into at least a decrease for those summer months was because people were so good about staying home. And I completely understand the emotional draw to wanting to spend time with friends and family over the holidays, but I think all of us who work in public health, who work in healthcare, the most important thing we can say or do right now is please stay home. We know that household contacts and gatherings of 10 or more are a major factor in virus transmission. The reason that we didn't see huge spikes this summer as a result of protests and large gatherings is because people were outdoors, they were wearing masks. So that behavior is incredibly important to continue as we move forward into these winter months. And there is a vaccine on the horizon. You know, I was in a meeting a few weeks ago when we were first talking about the vaccine, and I wept. I was sitting at my computer in this WebEx just crying because it felt like, okay, there's a light at the end of what has been a very long and challenging tunnel. And so I think anyone listening to this, if you can just hang on to that light a little bit longer and stay home, that's ultimately going to get us to a point where we can defeat this. But it's going to require collaboration amongst all of us. so much of what is going to have to come after is the collective grieving for who and what has been lost to us. And my family growing up owned a funeral home. And so I've been thinking a lot about how important it is to create a space for that grief. Most people have not made it through the last many months without having a similar loss. And so being able to acknowledge that pain is going to be an important part of recovery, I think, for all of us. What's been giving me hope is just the sheer time and enthusiasm and passion that people have been pouring into public health since January. And I don't think that we as a public health world will ever be the same after this. I don't know that we as a country will ever be quite the same, we as the world, but I hope that whatever lessons we learn about the importance of community are ones that we can take away far past this experience. For everyone who's played a part, I'm extraordinarily grateful, and I know that we're all going to get through this together. It's the only way out.
Nurse and contact tracing whiz Kathleen Blaney is, pay attention because there's a lot here, the Director of Disease Control Emergency Preparedness at the New York City Department of Health and Mental Hygiene. She's also the Deputy Director of New York City's Test and Trace Corps, a public health initiative which, in a matter of weeks, during a public health emergency, trained and onboarded 3,000 new contact tracers remotely. While contact tracing itself isn't new, the scale is. Kathleen and team are building and managing one of the largest contact tracing endeavors in modern history. Throughout this pandemic, public health departments continue building their wings after a deadly virus has taken flight within their communities, building the plane as they fly it, as innovators often say. Months into the COVID-19 pandemic, emergency response remains a work in progress, responding to new evidence, new information, and new vaccines. Along with the testing and stay-at-home orders, states are training thousands of people to do the time-consuming, highly detailed work of contact tracing, and doing so oftentimes by adapting existing technologies and applications for new purposes, all while combining it with the time-tested, boots-on-the-ground efforts to locate people who may have been exposed and provide them with what they need in order to prevent transmission, safely isolate, and be taken care of. The process of contact tracing is inherently intimate. Calling people you've never met at a time when they may be frightened and vulnerable, sharing their test results, asking how they're feeling and what symptoms they might be having, asking who they've been in contact with, where they've been, and what they need in order to successfully self-isolate. If they have enough food and medication, maybe they need their dog walked or their laundry washed. This public health measure of contact tracing is also an opportunity for building and strengthening trust, and when done well, can have benefits long into the future. But the consequences of failing can be catastrophic, which is why it takes a lot of training, sensitivity, and so many skilled people. The magic that makes all this work is time and trust, and that requires humans. And at this scale, technology and innovation. For See You Now, I'm Shauna Butler. Thanks for listening, and thank you for staying home.
Subscribe to See You Now wherever you get podcasts, and we'd so appreciate it if you share the show with your friends. It really helps us out. And if you have a moment, drop us a line and let us know what you think of the show. hello@seeyounowpodcast.com. Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Learn more at seeyounowpodcast.com.